If I were to choose a hormone that impacts skin aging the most and plays a very significant role in how the trajectory takes place in your skin, it's estrogen.
By the age of 40, over 70% of women report sudden changes in their skin. Dryness, breakouts, sensitivity, pigmentation, often with no clear explanation. For many women, skin is actually the first place perimenopause shows up. Estrogen plays a central role in collagen production, hydration, barrier strength, and inflammation control. And during perimenopause, it fluctuates. Skin feels every shift. We're joined by Dr. Ruba Bahhady, a dermatologist with over a decade of experience treating complex and hormonal skin concerns. In today's episode, you'll learn why skin changes often appear years before other perimenopause symptoms, why skincare routines suddenly stop working even when nothing else has changed, what supports skin during perimenopause and what quietly makes it worse, why perimenopause is starting to creep up, what's happening.
Anything related to the cycles that women go through, starting since they're teenagers into the puberty years, 20s, 30s, and then when they get pregnant. There's so much fluctuations that happen throughout those times. And I think one of the least addressed period is perimenopause. And I believe that's mainly because
How can they possibly prevent or prolong this period?
one of the most critical factors is
Today's episode is sponsored by Laurus Organics, a premium wellness distribution company. Because the truth is, we can elevate our health by making more conscious choices about what we put on our skin. Because Laurus's ethos is what goes on, goes in. Laurus brings certified organic skincare like Najl France to the GCC region, aiming to make organic skincare more accessible and convenient to find, with a natural approach to anti-aging. Explore the range at laurusorganics.com. Now go enjoy the episode.
Hello, everyone. Welcome back to Balance Not Boring. It's Tamara here. Judy's still not with me, but she's still with us in spirit. Today, we're going to talk about perimenopause and skin, such an important topic. So just to start, we want to give you a little bit of statistics. By the age of 40, over 70% of women report sudden changes in their skin. Dryness, breakout, sensitivity, pigmentation, often with no clear explanation. For many women, skin is actually the first place perimenopause shows up, years before missed periods, hot flashes, or the word menopause is ever mentioned. Instead, women are told it's stress, aging, over-exfoliating, the wrong serum, so they switch products, push harder, and quietly blame themselves. But what's really happening is hormonal. Estrogen plays a central role in collagen production, hydration, barrier strength, and inflammation control. And during perimenopause, it fluctuates. Skin feels every shift. In today's episode, you'll learn why skin changes often appear years before other perimenopause symptoms, why skincare routines suddenly stop working even when nothing else has changed, how to tell the difference between product irritation and hormonal skin shifts, what supports skin during perimenopause and what quietly makes it worse, how to approach aging, sensitivity, and treatment without overdoing it or damaging your skin, because confusion isn't failure. It's usually a sign that something important was never explained. We're joined by Dr. Ruba Bahhady, a dermatologist with over a decade of experience treating complex and hormonal skin concerns. She's trained internationally, practices across Dubai and Abu Dhabi, and is known for her natural, conservative approach to cosmetic dermatology, supporting the skin through aging and not fighting it. Dr. Ruba, welcome. Thank you for being here.
Thank you for having me.
We have so much to unpack today. So let's get started. I want to start with the basics, who you are, how you got into dermatology, and why perimenopause is starting to creep up. What's happening?
Okay. So basically, I started my practice in Saudi 16 years ago after graduating from the American University of Beirut. And then I moved in 2013 to Abu Dhabi, and I've been practicing there and between there and Dubai, mainly in Abu Dhabi, since 2013. And the reason I did dermatology, I guess it's because I never imagined myself doing anything else. So when I went into med school, I knew since the beginning, skin is the organ that I want to indulge in. And when it comes to the topics at hand and the topic that we're addressing today, I think it's a very important topic that's becoming more and more à la mode. Okay, so it's been discussed on social media forums. It's been embraced more and more by the general population. I think anything related to the cycle of women, the cycles that women go through, starting since they're teenagers, teenagers, into the puberty years, 20s, 30s, and then when they get pregnant. There's so much fluctuations that happen throughout those times. And I think one of the least addressed time period is perimenopause. And I believe that's mainly because it's understudied and it's confusing. Okay, because of the hormonal fluctuations that women go through this time, it's really hard to pinpoint what's going on. And that makes it even harder to address by physicians. What's happening? Why are you getting these symptoms more before other people? It's very, very complicated.
Absolutely. So what are we looking at when it comes to hormones directly affecting the skin?
So we know that hormones affect the skin throughout a woman's lifetime because of the fluctuations I mentioned. As compared to men don't go through those fluctuations as compared to women. Yani basically, they might have a peak during puberty, but then more or less it's constant. It starts to waver towards the 50s and the 60s. But with women, it's a lot more active. Okay, the peaks and the dips are a lot more impressive. The issue is that skin is an endocrine organ. So it's considered very related to hormones because we have hormone receptors in our cells in the skin. Mm-hmm. So we have estrogen receptors, we have progesterone receptors, and it drives the skin in certain directions at different times of our lives. So we know, for example, that during perimenopause, the estrogen levels are going down, and that's going to impact several factors in the skin. So we have, for example, a decrease in what's called transepidermal water loss. So patients are in that report dryness, and that's mainly because we have increased water loss from the skin itself. So sometimes patients ask me, well, I drink so much water throughout the day. Why is this still happening? Because it's independent of the water intake that we have systemically. Mm-hmm. Okay, so there is a water loss that's increased in the skin itself. In addition, we have the decrease of what is called glycosaminoglycans, which are what support the skin in terms of turgor. Okay, so it's like the extracellular matrix that adds firmness to the skin. Not only that, we have the decrease in elasticity, and that's reflected through the decrease in collagen content and elastin fibers. Mm-hmm. So all these things are dipping down, and that's going to impact the skin in terms of sagging, in terms of the formation of fine lines and wrinkles. And patients usually start to see that towards the late 30s, early 40s. And I know that there's now a lot being said about a certain age, like 44 and 60, are times when women really feel that there's an overnight shift in their skin health. But it's a much more gradual process. I think it's maybe the realization or the acute onset of the events are not really there. It's really a gradual change that starts in the early 30s in reality.
And now that we have that information, so people entering into their 30s, how can they possibly, prevent or prolong this, this period, this perimenopause? Or is it inevitable that you're about to lose elasticity or loss of water? Are these just things that are just going to happen naturally?
They will happen naturally, but there's definitely a lot that can be done about it earlier on. Okay. Mm-hmm. So a lot of the patients who come in their late 20s and early 30s, we educate them about what can be done to delay these symptoms. For example, one of the most critical factors is UV exposure. So patients who are still getting a lot of sun exposure without using, sun protection or even UPF clothing, I tell them that whatever you're coming to do with me, you're negating, you're going to be opposing with going to have a tan, for example. So UV exposure accounts for maybe 80% of aging, of skin aging. And basically, the earlier you start protecting yourself, the better you're off. So even if you've had several sunburns in your 20s, you cannot correct the DNA damage that has been caused by that time. So what you can do is prevent further damage. So UV protection is key. Using certain ingredients at an earlier age as well. We'll address that, I guess, with later questions. So using certain ingredients earlier also helps a lot. Seeing symptoms at an early age, for example, for patients who have polycystic ovarian syndrome, we know that impacts the skin in terms of breakouts, hair loss. So all of these things need to be addressed early in order to prevent further damage that patients can complain about and not have the adequate solution for at a later age.
And why do you think that, I know the skin is the largest organ in the body. That's as far as I know about skin. Okay. But why is skin the first sort of place where things like hormonal changes appear? Usually we think of other factors before skin.
The thing is, when it comes to hormonal changes, I think they're really happening all throughout our life, okay? When it comes to women. When it comes to perimenopause, I wouldn't say that that's the first thing that we see. Okay, because it's very subtle. The changes happen in a very, very subtle way, especially in the 30s. Okay. In the 40s, by the time women get to 40s, I think they do have other symptoms before the skin. So, and I see that in day-to-day practice. So patients in their 40s start to experience, for example, increased fatigue, brain fog, their cognitive function is not the same. They are more irritable. There's higher chances of depression or, just being down. And I think those are the things that we see before we see skin changes. And the issue is that this is impacted by a lot of things during that phase. So during the 30s and 40s is when women are having babies. They have a lot of responsibilities, including family. Their parents are getting older. Their babies are, growing up, and, you want to be there. You want to nurture them as much as possible. It's the peak time in career. So that's also another stressor. So I feel like it's there are so many factors that can play a role in everything that we see when it comes to symptoms. So when it comes to the skin, it's a lot more subtle in the 30s, I would say. In the 40s, we see it more. I think that when it comes to perimenopause, I personally hear the patients complaining a lot about other symptoms before they complain about the skin. Yeah.
And usually at the point where patients come to see you, what's the first, the earliest skin changes that you notice? Is it the dryness? Is it the elasticity?
I would say fine lines. Okay. So a lot of patients come complaining, I'm starting to see the forehead lines, for example, or pores that are increasing, I feel I have to put a lot more cover up when I'm going out as compared to before. And that's due to subtle changes, which are probably the dryness, also the loss of collagen. We know that starts in the late 20s, early 30s. And during menopause, 30% of the collagen content decreases in the first 5 years. But we're building towards that, earlier on. So that's the most frequent complaint. Another complaint is increased sensitivity, but I find that comes a little bit later. So patients, for example, who are using a certain skin routine suddenly find that it's not working for them anymore as much as it used to. I used to use these things. I've been using them for 5 years, and suddenly I'm breaking out. My skin is reacting. It's getting more irritated. So those are the complaints that we usually see earlier on.
That's so interesting. It's amazing how our body consistently changes, and it gives you signs of breakouts. It gives you signs, I'm assuming also products can cause other issues like itchy skin, especially when it comes to, I'm talking also from personal experience, the scalp. I know the scalp, of course, is part of the skin organ. How does also the scalp change? Is it increased oiliness? Is it also dryness? Is it shedding of the hair?
Yeah. So when it comes to scalp, the changes, it's also quite complex, because patients, for example, who have had a dry scalp all their life suddenly feel like it's oily. Okay. Or vice versa. Patients who have had oily skin all their lives suddenly feel it's going very dry, getting very itchy. So definitely that we do see scalp changes, and we just have to, somebody who's been using, for example, a certain shampoo might have to shift to an antifungal shampoo to decrease the microbes on the scalp area, because we all have microbes all over our skin and they play an inflammatory role. So these kind of shampoos might need to be implemented later on. So that's all based on the patient symptoms. But in terms of hair shedding, that's something that is quite significant. So I would say hair shedding is one of the earlier symptoms of hormonal changes. And a lot of the times I ask patients to be seen by an endocrinologist to do a full panel of a hormonal workup, because we know that not just estrogen and progesterone affect hair growth and skin health, but testosterone, prolactin, DHEAS. So those are other hormones that also can be impacting. So I remember a patient, for example, was having intense breakouts, something that was unusual. She's had breakouts all her life, but suddenly they became more intense. And then a blood test showed that she had an elevated prolactin level, and that needs to be addressed by an endocrinologist. So we don't work solo. Skin, the endocrine system, the immune system all have a very close interplay. So we need to make sure that patients are also seen by other practitioners, and we have a sort of like a implemented that involves all those different factors.
In terms of hormones, I'm going to shift gears a little bit, just to take a step back. Can you explain the key hormones that we should be looking at? And just for us to understand what's the role prolactin plays, what's the role progesterone plays, so we can use these for our knowledge.
Yeah, I think it's quite complex to address in this session. And I think an endocrinologist would be the best person to explain the details because they're really all cycles. They're all linked together. But if I were to choose a hormone that impacts skin aging the most and plays a very significant role in how the trajectory takes place in your skin, it's estrogen. Okay? Because we know that with hormone replacement therapy, which is, of course, there's estrogen plus progesterone, but we know that estrogen is the one that plays a major role in reversing some signs of aging. So women who are supplemented with estrogen do have an improvement in their collagen content. They have an improvement in the way that their skin appears. Instead of appearing dry and dull, it starts to look more hydrated and glowy. We know that fine lines can also be impacted by supplementing with estrogen. Hair health is impacted by estrogen as well. So that would be the hormone that I would choose to educate patients about the most. I personally don't give hormone replacement therapy because like I said, it's a very complicated specialty. And I prefer to send my patient to my colleagues who are endocrinologists because reaching also the right dose for different women is very complicated. So some women would respond better to a certain combination as compared to others. And that takes time. It takes months for women to find the right hormone replacement that suits their body. I usually refer my patients to endocrinology specialists.
Also, I wanted to talk about, you talk about dryness, of course, collagen reducing. What about skin pigmentation?
Yeah.
Does it appear? Do we all have it and suddenly it appears during perimenopause, or is it something that we should look out for?
Yeah. So skin pigmentation and melasma is also known to be impacted by several factors. Hormones definitely do play a role. And an example of that is when we have a patient with melasma, we automatically ask if they're on oral contraceptive pills because they have been associated with the appearance of melasma. Okay. Another thing is a history of pregnancy, because a lot of what's known as the pregnancy mask or the melasma mask appear during pregnancy. But however, that is also impacted by genetics. So some people are just simply more predisposed as compared to others. That is impacted by UV exposure. Okay, so patients who sunbathe, who are not using photoprotection every single day will have higher risks of pigmentation somewhere down the road. Okay, so sun damage is cumulative. Okay, so even if you start being religious about sun protection in your 30s and 40s, it does not eliminate the sun exposure that you got in your early childhood. So I personally had several sunburns, like major sunburns during my childhood. And I feel that I have to be so diligent about sun protection because I know the damage then has been done and I don't want any further damage. Since I entered dermatology residency, I became more aware of that. So those are all factors that impact pigmentation. Now, when it comes to perimenopause and menopause, definitely hormones do affect pigmentation. However, is it the variability, the ups and downs of those hormones, or just the decrease or the decline? It's thought that it's really the variation in perimenopause that can impact the appearance of pigmentation rather than a drop, okay? Because when you think of it, during pregnancy, estrogen and progesterone increase, and that is what makes the melasma appear. Whereas in menopause, it decreases. So when you think of it, it should be actually getting better. But also what gets worse is cell aging. So cell senescence, okay, or aging of cells in the skin can impact the outcome of pigmentation. So yes, your estrogen, progesterone are dipping. So in theory, your pigmentation should not be getting worse, but your cells are aging, and that can impact your pigmentation getting worse. So it's not very straightforward.
And I wanted to address a question that a lot of people here, I know in the region, have a vitamin D deficiency. And the first thing is go under the sun, get vitamin D.
Right.
How do you manage that? If it's going to harm your skin, what times of the day?
It's quite easy, actually. It's quite easy.
Please tell me.
Yes. So the way I manage it is, first thing I tell patients is that your face and neck area, chest as well a little bit, are the areas that you get the most sun exposure throughout your life. Okay, so please protect that. If you want your vitamin D, it does not have to come from your face and neck area, because those are the areas that show the signs of aging the most. Yes, the skin ages all over our body, but this is the area that's the most exposed, so it will age faster. So what I explain to patients is that to get the adequate amount of vitamin D, all you need to do is expose your arms and legs for 10 minutes a day. Okay, or if you want to do it like at an interval, you can do it like 20 minutes, 3 times a week. And that gives you enough vitamin D. So that will induce vitamin D without having the harm. So some people think that I have to be under the sun for hours to get enough vitamin D. And all you're going to get is DNA damage induced by UV exposure, which will age your skin faster. It will put you at a higher risk of developing skin cancers. Mm-hmm. We know that that is a major component of developing skin cancers. So no, you do not need extensive hours in the sun to get your vitamin D.
Okay, that's very good to know. Yeah. I don't want to think of the damage that I caused when I was in my 20s.
Yeah, we all do.
When skin changes are hormonal, what skincare realistically can help, especially during perimenopause, or is it individual to each patient?
Of course, it's very individual, but there are major, like the basic ingredients, I would say. So for me, basic ingredients, as mentioned several times so far, is sun protection. Another thing during perimenopause is picking the right type of moisturizer or not. So basically, some women who experience hyperseborrhea, so oily skin during that phase, you want to moisturize, but with very lightweight moisturizers, okay? On the other hand, patients who experience extreme sensitivity, dryness, they would need heavier moisturizers with ceramides, for example, that will hold the moisture better in their skin. Mm-hmm. So those are 2 ingredients I would say that we need to address most of the time with all the patients. Second is cleansers and exfoliation. So I just find that exfoliation is overdone. Toners are overdone. I know a lot of physicians do recommend having a cleanser and then a toner. I find that during this period of perimenopause and menopause, these items tend to be a little bit harsh on the skin. And the much needed sebum that you need during that phase is ripped off with these aggressive kind of ingredients. So using milder ingredients would be a better idea during this period of time. Of course, we're not talking about puberty or 20s when you actually might need those ingredients. Other ingredients are, of course, retinoids. Mm-hmm. Okay, so retinoids are very well known to have so many positive impacts on the skin. And there are many different types of retinoids. So I always, because initially
what
they
do
can
they
be,
do? What do retinoids do?
Retinoids help with everything. Mm-hmm. They help with, we give them to teenagers to reduce the appearance of comedones or blackheads and whiteheads. So they can treat the different stages of acne. Retinoids can help to reverse DNA damage induced by the sun. They can organize how pigment is distributed in the skin. So we use them for melasma, for example. Mm-hmm. And they're anti-aging. So basically, they are known to slow down the breakdown of collagen that increases with time. So starting a retinoid in your 20s is probably the best idea. Mm-hmm. Okay. And there are different forms of retinoids or vitamin. They're also known as vitamin A derivatives that can be used. So the basic is tretinoin, which is known to be the most harsh. So it can cause, the side effects are known to be irritation, flakiness, redness, just unpleasant. But there's retinaldehyde, there's retinol, there's other forms of retinoids that could be more suitable for the sensitive skin type. And it's also about how they're used. Mm-hmm. So initially, patient who has never used a retinoid, I ask them to do what's called short contact treatment. So just exposing your skin 2 or 3 nights a week to the ingredient, removing it after an hour or 2, putting a moisturizer, and then going to sleep. And this is a little in which you can expose your skin to this active ingredient, let it adapt over weeks. It could take months to adapt to a retinoid, and it eventually works very well. So retinoids are a very important ingredient that I would want all my patients to be using. Other ingredients include vitamin C, because we know it has anti-aging properties, it improves pigmentation, it has an antioxidant role to the base. So basically it helps with reducing the reactive oxygen molecules that are created with UV sun exposure. And that's why I usually recommend that it's used in the morning before sunscreen.
Okay.
Other ingredients that are known to have hydrating properties in addition to anti-aging properties are alpha and beta hydroxy acids. But those can be quite irritating for a lot of patients. Again, there are the milder forms that might take a little bit longer to show their impact on the skin. Even if it takes longer, you're going to be using them forever anyways. So milder ingredients does not mean they're not as effective. They're just more convenient. So those are the 5 main ingredients. I have patients who love to have a routine and they love to have steps, like several steps in the morning, several steps in the evening. But I find that during the 30s and 40s, you have so much on your plate anyways, that I tend to want to really simplify the routine. Okay, so I would just recommend a serum and a sunscreen in the morning, a moisturizer and an active ingredient in the evening, and that's it. And it doesn't have to happen every night. So if you're coming back home from work, you have 2 or 3 kids to run after, and you're just dead tired by the end of the day, just cleanse your skin, put a moisturizer and sleep. Or just cleanse your skin and sleep.
Exactly.
Yeah.
And what if you have extra sensitive skin? For example, I have extra sensitive skin. Vitamin C doesn't necessarily work well with my skin.
Skip
or
it.
tretinoin or whatever.
I would say prioritize. Okay. So prioritize one ingredient at a time. So I would want you probably to start with the retinoid because that's the most important ingredient. And I would recommend a mild one. Okay. Something with a low percentage of retinaldehyde or even a very, very low percent of retinol. And I would ask you, I would be happy if you're using it 1 night a week.
Oh, wow.
Yeah. So it could be 1 night a week for the next 30 years is definitely going to play a role. So if you can manage 1 night a week, it would be still a plus.
Good. No, it's good to know that because I know because like you said, a lot of us like routine. I personally like a routine, but I don't want to have a 10-step skincare routine. I think it's unnecessary.
The minority do. The majority wanted to be simplified.
So like 2 or 3 steps I'm fine with. Like you said, kids and just life in general.
Exactly.
But when you have patients that come to you and nothing's working on their skin, nothing at all is working, how do you approach that and prepare them for the hormonal changes?
So the thing is, when nothing works or everything irritates, that's when we probably need to resort to other measures. Okay, so sometimes oral or systemic treatment really can help, especially with breakouts. There are studies that show that, let's say, women in their 40s with undergoing hormonal breakouts, even though all their hormones in the lab are normal, they still have breakouts. So a lot of the times for those women, oral retinoids is the only thing that's going to control their breakouts. Of course, oral retinoids have side effects. They need to be monitored. So maybe it's not the first thing I would want to jump to. But honestly, with a handful of women, I would say that's the only thing that can help. Other than that, systemic treatment do include, especially towards when we're talking about the perimenopausal, menopausal period, hormone replacement therapy. And of course, that's when I would want to introduce the topic of in-clinic procedures. Okay. So we know that definitely has a major impact on delaying the aging of the skin. It will happen when I see, for example, a 45-year-old woman who's been doing certain procedures as compared to a 45-year-old woman who has done nothing. There is a massive difference with the way the skin appears, with the general glow, the fine lines, the sagging. So definitely in-clinic procedures do play a role. But of course, what we want to push onto patients because it's sometimes not very sustainable, with life and all of that.
And when you have a patient that's entering perimenopause and they're in the clinic doing injectables, facials, things, to stimulate more collagen. Do you treat them a bit more cautious or differently because of the hormonal changes, or do they have side effects?
I would probably start with milder treatments, especially, but I would say that applies more to menopausal women. Okay, as compared to perimenopause. Because with perimenopause, it's hard to pinpoint it. exactly, like, are they actually going through it, or is it just like,
Yeah.
and the normal aging process that happens in the 40s. But in the 50s, that's something I would take into consideration more, because we know that when women hit menopause, their wound healing capacity is not going to be the same. So I would be less aggressive with treatments. I would use less aggressive parameters with any laser treatment I want to, integrate into their program. In addition, their response to biostimulators. So biostimulators play also an important role for us in dermatology and in the induction of collagen formation.
So biostimulators are collagen induction?
Yes,
Okay.
exactly. So they're injectables that can stimulate collagen production. And we know that in the 50s, the ability to synthesize collagen or menopause is going to be reduced. So I let them know that their responsiveness is not going to be the same as, for example, a woman in her early 40s. Again, to add to the complexity of this, I've had women in their 60s respond in an amazing way versus women in their 40s not responding in the expected way. So individual variability plays a very, very major role in the outcome of these treatments. And we really need to explain that to patients, because sometimes they could be disappointed regardless of their age.
I know that, it's a very sensitive time. No one can really, like you said, pinpoint what's happening, because there's all these shifts happening at once. And I know any transition in life is very, very difficult. And so you can't pinpoint, I'm losing hair because of perimenopause. It's not one thing, it's multiple things. And I can foresee some women go to the extreme and start buying more products, putting more things on their face, doing more facials, doing more. I know more is not more. So, but because of this sort of panic of what's happening, when does that become self-harm? So when is that, that when skincare turns into a little harmful?
So yeah, that definitely happens. I find that turns into self-harm when you overexpose your skin to too many ingredients, and then it gets irritated, and it's really very hard to pinpoint what is happening. So in these situations, I have patients stop everything that they're using and then start introducing whatever they were used to using one at a time, and giving a gap of around 2 to 3 weeks before they introduce another ingredient. And this way, it's easier for them to figure out what's going on. The problem is we're all in a rush, okay? We're all in a rush to see results, to see outcomes, and it's never a quick from anything. So that's why less is more, whether it comes to the products that you're using on your skin and whether it comes to what you're doing in the clinic, okay, in terms of treatments. Of course, like, I encourage treatments in the clinic, but sometimes when patients overdo it, there's something called skin fatigue. Okay, so the skin is really tired of the amount of facials or lasers that are sometimes not that necessary. So I think the best thing in these situations is to develop a relationship that is in a dermatologist that you can trust, who's going to advise you to do things that is really in your best interest. Okay, and that's mainly it.
I always ask this question, and I always think about it a lot, because I see two extremes. I see some women more is more. And then I see my 85, I think now, 85-year-old grandmother who is flawless skin and forgets to remove makeup from her face sometimes.
Yeah.
So it's a bit confusing.
True. First thing, congratulations on good genetics. Okay. So if your grandma has flawless skin at 84, the chances are your skin is going to be just fine. So that's where genetics play a role. Also, I think that generation had it different. Okay. So I do think that in our lifetime, we are exposed to more pollutants. Okay, whether they're internal or external, as compared to our parents or our grandparents who lived a more simple life, maybe. Of course, it had its complexities, but they were probably eating cleaner food. They were breathing cleaner air. They were living in a cleaner environment. So I do think that also has its impact on that generation. And that's why you see a lot of patients now shifting, or people in general, not just patients, shifting towards a cleaner lifestyle where they want to have the least amount of preservatives or food additives in their daily diet. People who want to try to live in the countryside. I think patients or people in their 40s are looking towards that nowadays. So yeah, it's hard to compare because of the different environments that we live.
Of course. And speaking of, the environments that we live in now, how does the skin respond to cortisol and stress and lack of sleep? What shows up on the skin?
Okay. So the immunity and the skin are very linked. Okay. So when we get stressed, when there's lack of sleep, there's an increase in the cortisol level. And that's going to show up as inflammation in the skin. So for example, in terms of skin diseases, we know that things like psoriasis, atopic dermatitis, rosacea, acne, all will flare up during stressful periods of time. And that's how we know that someone is going through a phase. And that's why we need to try and control all of these things. Of course, it's not easy to control stress, but it is part of what we educate our patients about.
No, it's really important because I find that especially women that are entering this transitionary period, like we were saying, more is more. And that maybe it's just try and get extra rest, try and find a quiet space, a quiet moment. It doesn't necessarily have to be more facials, more injectables, more.
Keeping things simple. We know that a healthy diet, a healthy exercise routine, healthy sleep, minimal stress are going to play a major impact on your life as a whole, not just on your skin, on your mental well-being. It's just, I think we cannot oversimplify it as well because life is stressful. So we also need to hear out the patient and what they're going through. And sometimes I have some patients, they say I'm their therapist because they come and they just offload what's going on. We do a skin treatment, makes them feel better. And I think that's a healthy relationship,
Of course.
But of course, trying to optimize all of these factors is going to play a positive role on health as a whole, in addition to the skin, of course.
Of course. And I want to talk a little bit about, the cortisol and the lack of sleep and perhaps this, no time for anything. And that, that's a buildup of inflammation. And I know inflammation can appear, from, internally, I look at inflammation as something that's, continuously growing and throbbing and it looks red to me. But does that sort of translate the same way in the skin? Does your skin turn red? How does inflammation appear on the skin?
I mean, not necessarily, but inflammation, it depends what your skin is experiencing as a background. So patients who have a history of certain skin diseases, that's how it will appear. Okay, so it will be an exacerbation of their skin disease. With women, for example, who are going through menopause or perimenopause, inflammation does increase. And the way it will appear on somebody with no history of skin diseases is by irritation. So irritability of the skin, it becomes more sensitive. You can be putting a certain serum that used to cause nothing and suddenly it causes itchiness, redness, and flaking. Sometimes patients come with a new onset of rosacea, which means that the vascular element in the skin is not in its best form. So it's basically more fragile.
Is it when the skin becomes extremely red?
Red, yeah. Red. And usually it's on the face. We see it mainly in facial flushing, for example.
Okay.
Yeah, so that's how we see inflammation. Plus, on a molecular level, inflammation in the skin is the increase of pro-inflammatory cytokines and a decrease of anti-inflammatory cytokines, which are inflammatory mediators. So, for example, in some studies that were done to see the impact of a certain treatment on the skin, they take punch biopsies and they study the expression of these cytokines in the skin. And that's how they prove that this is a treatment that has anti-inflammatory effect.
If we have a lot of women listening to this podcast, what's one thing a daily habit that they could do to see a more visible glow for those that feel like they lack one?
I would say one thing is sun protection. Okay, because it's a simple cream that has hydrating effect. So some people say, do I have to put a moisturizer before? Sunscreen is a cream at the end of the day, and it will offer some kind of hydration.
What kind of sunscreen? Because there's mineral, can you talk to us a little bit about that?
Sure. So basically, two main categories, the chemical versus the physical sunblocks. Physical sunblocks are also known as mineral sunblocks. So those are the sunblocks I would recommend to patients who have very sensitive skin because of the reduced amount of chemicals in them. But for somebody who doesn't have very sensitive skin, it could be either or. Of course, there's the whole topic of them being harmful to the environment, but that's a whole topic on its own. So day-to-day basis, I would recommend an SPF of 50. Okay. Most sunscreens nowadays come as 50, but it's not basically 50 does not mean it's a lot better than 30. And 100 is not much better than 50. So SPF 50, for example, would protect you 97 to 98%, and SPF 30 is 94 or 95%. It's really about the quantity that is applied, and most patients, I see them in the clinic, don't apply enough in terms of quantity.
What are we looking for quantity-wise?
So basically, it would be, I would say, a teaspoon for the face and neck area, and for men, it's the scalp.
Teaspoon.
Or let's simplify it. For the face, I would do finger lengths of sunscreen. With the neck, you add one more. So that's a lot more than what people usually apply.
Oh, I don't put at all that amount.
Yeah. So that's why let's say you're going to spend some time at the beach. I usually tell my patients, please be very generous. Apply your sunscreen every 1 to 2 hours, because I know they're not applying enough. For the body, you need 1 ounce of sunscreen, like 30 mLs of sunscreen to put over your body in the sun exposed areas. So in that situation, for example, for children, I prefer UPF clothing. Even for adults, it's not the best fashion by the beach, but it's really the most protective and environmentally friendly to wear the UPF clothing rather than slather on an ounce of sunscreen all over.
I don't think we're doing either.
Yeah, I know.
But no, sunscreen is really very important.
Yeah.
And I think it's one habit that a lot of us should really take seriously, and not every other day, and put enough, like you said. I had no idea it was 2 fingers and 3 and the third one for the neck.
For the neck, exactly.
It's really, really important to know that. I wanted to get into more of a myth or fact, like a myth buster situation. So we're going to start off with myth or facts.
Okay.
So the first one is, hormonal skin problems only start when hormones drop.
Okay, I would change that to fluctuate.
Okay.
All right. So because it's not necessarily a drop. Okay. It's really fluctuation, especially when it comes to women.
Good to know. Oiliness and breakouts mean skin is overactive.
It's a little bit simplified. Okay, because sometimes it's the dryness that leads to excessive sebum production. So it doesn't mean that so I just think it's oversimplified that way.
Okay, fair enough.
Because overactive could also be inflammation and dryness. So it's very individual.
Skincare routines fail because products stop working.
It's because we're probably not using the right products for our skin, and we're not taking into consideration what our skin is going through that phase in our life.
Inflammation on the skin always comes from irritation.
Always? I wouldn't say always, because irritation is what we imply with irritation is external irritation. But inflammation in the skin could be also systemic inflammation. So the skin is very often a reflection of what's going inside our body.
Hormonal acne is simply estrogen versus testosterone.
That's also oversimplified. It's more complicated. Yeah,
of course. Before we wrap up, if there's one thing you want women to understand about their skin during perimenopause, something that brings clarity or relief, what would it be?
I would say that there are many options available. Don't despair. Don't give up. Don't assume that this is it for me and there's no solution. It's just with some women, it just might take more time, more effort, more patience to reach the optimal skin routine or the optimal replacement therapy that will suit their body. So it's a very, very frustrating time. And a lot of women dip into that, like nothing's ever going to work for me. And it's not the case. There's always something that can work.
Don't give up.
Don't despair.
If there's one thing this conversation makes clear, is that perimenopause isn't a problem to fix. It's a phase to understand. The confusion so many women feel isn't because they've done something wrong. It's because no one explained what was changing. Your skin isn't failing you. It's communicating. That statistic we opened up with, 70% of women noticing sudden skin changes by 40, isn't a warning. It's proof that this experience is common, is shared, and long overdue for better conversations. Dr. Ruba, where can people find you?
Okay, so I'm in Abu Dhabi 4 days out of the week. I work at Beyond Skin Medical Center, BSK Medical Center. And in Dubai, I come once a week and I work at Premium Cosmetic Laser Center.
Any Instagram handles, website?
Yes, I have my own Instagram that patients usually contact me on. So it's Dr.Ruba Bahhady.
If this episode resonated, pause before chasing the next product or treatment and start by asking better questions instead. And if you know someone quietly struggling with skin changes right now, send them this episode. These are conversations women deserve to have before panic starts. Follow us on YouTube, Spotify, and Apple, and have a great day. Thank you for listening.